Welcome to Insider Medicine in Depth. I'm Dr. Susan Sharma. Individuals suffering from epileptic seizures, despite trying at least 2 anti-epileptic drugs, should be evaluated for their eligibility to undergo brain surgery without delay, according to research published in the Journal of the American Medical Association. Here is some information about epilepsy. It is a brain disorder causing individuals to experience repeated seizures over time. For some, seizures can be controlled with medication. Failing that, brain surgery may control seizures by removing the brain tissue where they begin. Uncontrolled seizures may make it difficult or impossible to drive or work and increase the risk of experiencing serious injuries. For the early randomized surgical epilepsy trial, researchers out of the University of California at Los Angeles randomly assigned 38 individuals with epilepsy who continued to have seizures, despite trying 2 brand-name anti-epileptic drugs to continue with medical therapy or to undergo brain surgery, as well as continue to take the drugs. The participants were followed up to 2 years to determine how well their seizures were controlled and how high their quality of life was. During the follow-up period, 7 of the 23 participants originally assigned to medical therapy alone ended up receiving surgery. In addition, 1 participant assigned to surgery did not undergo the procedure. 11 of the 15 patients originally assigned to surgery were seizure-free during the follow-up period, but this was not the case for any of the 23 patients originally assigned to medical therapy. There was a trend towards improved quality of life among those assigned to surgery compared with those assigned to medical therapy, and this trend became statistically significant when the participants who were assigned to medical therapy but who actually received surgery were eliminated. While memory decline was noted in about 1/3 of the patients who underwent surgery, there were not enough participants in the study to determine with any certainty if there were differences between the 2 groups with respect to intellectual functioning. We spoke with Dr. Jerome Engel, principal investigator of the study, who offered some further insight.
Early surgery, that's within 2 years of failure of 2 medications, provides excellent results. There's an 85% chance of seizure freedom and a statistically significant improvement in quality of life compared to patients who continued on medication for 2 years. That's the bottom line result. The overall message, though, is this is early surgery. And the problem with surgical treatment for epilepsy is that it is the most underutilized, probably, of all approved medical interventions, all therapies. And the reasons for this are not clear at all. That probably less than 1% of patients with seizures that don't respond to medication are ever referred to an epilepsy center to see whether they might be candidates for surgery. And patients who are referred for surgery are referred an average of 22 years after the onset of their epilepsy. And by that time, their lives are so disrupted by going through adolescence and early adulthood with disabling seizures that they have not had an opportunity to gain the vocational skills and the interpersonal skills to live an independent life, and they remain dependent on their families and on society. And it's a shame because if they were operated on early, they could be saved from a lifetime of disability.
Today's research suggests that once 2 anti-epileptic medications fail to control the seizures of individuals with epilepsy, it is best to immediately refer these individuals to an epilepsy center to evaluate their eligibility for surgery rather than take a wait-and-see approach. For Insider Medicine in Depth, I'm Dr. Susan Sharma.